Preparing and testing syringes should be done prior to the beginning of anesthetic administration. Determining that your harpoon didn't activate properly while trying to aspirate during an injection is not the time you want to find that out. Comfortable insertion, controlled delivery rates, and effective aspiration testing are all dependent on the proper assembly and functioning of your syringe. To begin assembling your syringe, check to be sure that all its parts are securely attached. Be sure that the thumb ring, barrel, and needle adapter are securely tightened. Oftentimes, these come loose and your syringe may literally fall apart in your hands. Holding the syringe in one hand, pull back on the thumb ring. This will move the harpoon out of the way so that the cartridge may be inserted in the barrel. The cap should be oriented towards the needle adapter and the stopper towards the harpoon. Release the tension on the piston, checking to be sure that the cartridge is completely and firmly inserted in the barrel. Engage the harpoon into the rubber stopper by holding the syringe in the ready for injection position and pressing the thumb ring until the harpoon is fully engaged. To confirm that it has been securely activated, gently turn the thumb ring. The cartridge should turn freely in the barrel. Attach the needle to the syringe. Begin by twisting off the small plastic end of the needle to expose the short, non-beveled needle shaft. Insert it through the needle adapter, gently piercing the cartridge diaphragm. Take care to penetrate the center of the diaphragm. Screw the needle on to the needle adapter. Your syringe is complete and ready for injections. Once your injection is complete, it is important to cover the needle immediately. Never leave an uncapped needle anywhere. Needle stick injuries present a significant risk for the transmission of infectious diseases. Inadvertent needle sticks during intraoral injections put healthcare providers at risk for contracting hepatitis, HIV, and other serious diseases. Attention must be focused on the careful handling of dental needles during all stages of syringe handling. There are a number of methods for safely recapping needles after an injection is complete. The scoop technique doesn't require any additional armamentaria, just careful maneuvering of sliding the needle into the needle cap while the cap is lying on the instrument tray. The needle cap must not be handled until the point of the needle is completely protected by the sheath. Care must be taken not to contaminate the needle during the process in case it needs to be used again. Once the needle tip is completely enclosed in the cap, you may secure the cap to the needle hub. Several apparatuses have been designed to act as barriers between the tip of the needle and the fingers of the healthcare providers throughout the recapping process. These can include things as simple as disposable cardboard barriers or autoclavable rubber devices. Disassembling the syringe and disposing of the needle poses further risks for needle sticks. Continued care must be followed through the entire process. The Center for Disease Control has issued guidelines for infection control in the dental health care setting. They include explicit instructions for handling needles. When doing this, using a one-handed method is best, always keeping the fingers on the cap side of the needle. Remove the needle from the syringe by rocking or twisting it off the needle adapter and removing the exposed penetrating end from the syringe, being careful of the now exposed sharp end. Sometimes the needle adapter will come off with the needle, so be sure that that doesn't happen. If it does, it should be removed with forceps or a hemostat. Never use unprotected fingers. Once needles are removed from syringes, it's required that they be placed in the appropriate sharps container. Under no circumstances should they ever be placed in the regular or contaminated trash. Continue to move the needle to an appropriate sharps container. Holding the sheathed end of the needle and cap, insert the needle into the receiving hole of the container according to the product instructions. Some recapping guides will stay in place until this step is completed and aid in placing the needle, sharp end first, into sharps containers. Once the needle is safely disposed of, remove the cartridge from the syringe. Do this by pulling back on the piston to disengage the harpoon. Tip the syringe to the side and allow the cartridge to fall free from the barrel. Occasionally, sharpers will remain lodged on the harpoon. If this happens, use forceps or hemostats after the cartridge has been removed to pull the stopper out. Never use fingers to dislodge stoppers from the harpoon. Empty cartridges are considered contaminated and the glass may be broken, so they also must be disposed of in the sharps container. Once the needles and cartridges have been properly disposed of, the syringes may be sterilized along with other contaminated instruments.